I was young, I was always active, always outside playing basketball, being around the drug dealers, and it was my peoples, whatever, wrong associates, things like that, and that's the outcome of that.
Getting a fresh start. Next on Black Nouveau. Hi, I'm Milton, Dockery.
And I'm Faithe. Welcome to Black Nouveau. On this edition, you'll see how the Northcott Neighborhood House is helping youth get a fresh start.
We'll look at a musical program designed to help veterans and hear from some daycare providers who are concerned that the crackdown of the Wisconsin Shares program is unfairly hurting them.
But first, November is Alzheimer's Awareness Month. Alzheimer's is a progressive and fatal brain disease which causes memory loss and problems with thinking and behavior. We begin our two-part series with a profile of Jestene McCord, a Milwaukeean who recently discovered she has Alzheimer's.
Started out maybe the first of last year, 2008, and I started noticing things that were not me. I'm usually very precise about what I'm doing, do a lot of planning, know what I'm going to do before I do it, and able to execute my plan. And then I was having a little trouble with that, and I'd have to really think about it and go through different processes and all that. And I just started thinking, this is not me. I need to do something about this. So, and then I started watching me closer. And this went on for a few months, and I was convinced then that I had Alzheimer's. I find myself having to make more notes and all that to keep, I was keeping up with things, but it was a lot of work, and it was never work for me. So I knew something was wrong, and then I started looking into a doctor that I would feel comfortable with and would trust, and doing some research and all, and I came up with a doctor and went to him, had my testing done, and he confirmed it.
Alzheimer's is a progressive degenerative disease that affects the brain. It actually destroys brain cells that affects memory and speech. And as it progresses, individuals become totally dependent. They can't care for themselves at all. The first sign is really memory loss, because that's one of the major symptoms of Alzheimer's disease. The other one is how it affects their speech. For example, with memory loss, it could be that you ask me what day it is, and I tell you it's Tuesday, and 5 minutes later you're asking me what day it is again. You did not connect that memory.
What steps have you taken that help aid you in moving about your day?
Well, I always had a Palm Pilot, I always had a computer, but I didn't depend on them. And now I find I'm depending on it. And I also have everything that's on my Palm Pilot, I have it on my computer. I use my computer every day. I go to it first thing in the morning, and it's just like it reassures me of what I'm doing or what I'm thinking of doing, because I've got things stored on there. And so that's kind of how my day goes. That's how I get along, get things done. And where I used to multitask all the time, and I might have 5 projects going, might be doing some for work and for school or for friend or all kind of projects going, and I could keep them straight. But now I can't do that many projects, which is good. I don't need to. It's too much work. But what I do, I keep a good record of it, or I won't get it done. A shout out, really, I want to give to my favorite Congresswoman, Gwen Moore.
You decided shortly after you were diagnosed with Alzheimer's to share with your radio audience. You do a radio show.
When I decided on a physician that I felt very comfortable with and I could trust and all, went to him, he did my diagnosis and all that. And at that first meeting, I asked him if he would feel comfortable coming on the show to talk about it, because I think the more information is out there, the better off we all are. So whatever I can do, I always try and bring information to other people and just let them see, because Alzheimer's is seen as such a dreaded disease. And I can remember when I was a kid, And although they didn't call it Alzheimer's then, it was just, grandma's, she's lost her mind or she's crazy or whatever like that. And people would put grandma, their older person, in the closet or back away from when company came. And I've seen those kind of things happen. And I think that's not good. And they were doing the best they could at the time, I guess. So, and I think the more information that we have, the better care that people will get, and the better people will understand the disease, and which will help all of us, the victim and the caregivers and whoever.
And joining me is Dr. Dmitri Mills, who was in the video package. Welcome, Dr. Mills.
Well, thank you, Faith.
How big is the Alzheimer's problem in the African American community?
Well, we have to reflect back on the problem in general for Alzheimer's disease. Alzheimer's disease affects about 5.3 million individuals in the United States. It's estimated that it affects us 2 to 3 times greater than it does the numerical majority community.
And why is that?
Our risk factors go up when we don't take care of ourselves. For a long time, we have not gotten our diabetes under control, our high blood pressure under control, and our cholesterol. And those factors presents a greater risk in developing Alzheimer's disease.
What are the symptoms of Alzheimer's?
Alzheimer's is a form of dementia. And dementia is a problem with our memory and other cognitive abilities. Alzheimer's disease makes up 60 to 70% of all dementias.
How can we tell the difference between Alzheimer's and just regular memory loss?
Okay. All of us begin to forget things as early as our late 30s. The difference between Alzheimer's disease and a normal memory loss is the fact that people with the disease cannot go back and pick up what they have lost. We can go back in normal aging and normal memory loss and retrace our steps and remember what we need to remember.
There is no cure for Alzheimer's. What treatments are available for the
No,
disease?
there is no cure for Alzheimer's, and we do not know exactly what causes Alzheimer's. I like to say that for us, in general, what we need to do is to take care of ourselves. Our diets, our exercise, there are memory things that we can do to help our memory. If we're diagnosed with Alzheimer's, there are medications on the market now that can lessen the worsening of memory loss. It's not a cure by any means.
You have Alzheimer's. How long can a person expect to live with Alzheimer's?
This is the insidiousness of the disease. A person can be diagnosed with Alzheimer's and continue living a very long time, from 2 to 20, 25, 30 years after diagnosis.
Sometimes people are diagnosed with Alzheimer's, but they may have had it for a while. Is there a time span there between before you're diagnosed to when you actually it may become onset in your life?
All of us know when there's something wrong with us, no matter what that is. We may not be able to put our fingers on it or something like that, but all of us know that when something is really wrong. When people cannot recall moment to moment, there's something that needs to be checked into. The problem with Alzheimer's disease and with any dementia is the fact that it affects short-term memory. We can't remember new things that we've learned very readily. So it affects different people in different ways, but normally it affects the short-term memory.
What is the expected age of Alzheimer's, the onset of it? We have about less than a minute.
Well, it's not age determined. However, the disease does appear to affect people after age 65.
Okay. How can people find out more information on Alzheimer's?
Oh, that's easy. They can call the Alzheimer's Association. We have a 24/7 hotline at 1-800-272-3900.
Thank you for joining us,
Thank
Dr.
you.
Mills. Next week, we'll look at the impact of Alzheimer's on families and caregivers.
These young men took a detour to the world of responsibility, but stayed in the game.
Better myself and get something from this experience.
I learned to trade. I want to be able to stay successful. I want to be able to stay on my feet, not be down. I want to be able to stay up.
They're doing this by participating in a program called Fresh Start. It's a program started 38 years ago in Madison, Wisconsin, and for the past 6 years, Northcott Neighborhood House has run this program in Milwaukee.
So many young men drop out of high school. This is a twofold situation. They learn a skill and they also work on their GED as well.
Our main purpose is to rebuild young people.
These young men admitted having troubles in the past, run-ins with the law, for a variety of reasons.
Money. Always, that's the rule of all evils. Money. A lot of people want things that you don't have, so take chances, and I made the wrong choices. I was young, I was always active, always outside playing basketball, being around the drug dealers, and it was my peoples, whatever, the wrong associates, things like that, and that's the outcome of that.
Glitter got to you, huh?
Yeah, glitter.
Before I had this job, I was stayed on the streets all night long, weed at the hours. I can't do it no more. It seemed like I had the thoughts like I wasn't gonna make it. I was gonna be out here on the streets and not have nothing, be homeless. And when I have a home, I have a job, I'm well taken care of. I never thought I'd be here, really, to say the truth. I thought I'd be somewhere else, way deep out somewhere, just in the gutter.
They're learning skills that they missed early on.
This whole job basically deals with math, so that's basically what I'm really learning right now.
The job skills, basically being on work on time, consistent work, basically.
Teaching some of those skills is a man who came out of retirement. What are you offering these young people?
Trying to offer something other than what I learned how to keep a job. Work hard, be responsible, and that's what makes you keep a job.
When you first see them, do they have those skills needed, or you gotta, give them some encouragement?
You got to encourage them and keep encouraging them day after day. Because the more something, they always had their way. They always say, oh I can't, I shouldn't. And they didn't get that. So my job is to try to make them learn that they're supposed to be responsible.
And there is also a class element to this project.
Most of the young men that come to us don't have a high school diploma, so they have to attend GED classes 2 hours a day to get their GEDs. Then we work with Milwaukee Area Technical College. The young men get math for carpenters, building materials, OSHA safety, and cabinet making 1 and 2.
What are you learning now that you did not learn in school, be it in junior high or high school?
Reading this tape right here.
You couldn't do that in school. Why not?
Clowning, basically. I wasn't paying no attention. Like to hear.
So now you're paying attention. What did the teachers not do to get your attention that they should have done to get your attention if you weren't paying attention?
Hands-on, basically. It's hands-on. It's hands-on. They're teaching us hands-on.
And the teachers weren't giving you that hands-on?
Mm-mm.
Same question about learning in school with a similar answer.
Really the hands-on work. We didn't have too many workshops and stuff like that, so it's hands-on. Everything I'm learning is based off me measuring the tape, me cutting this board, me putting everything up, nailing it, measuring it, checking it, just hands-on work.
What are things teachers overlooked while you were in school that they may could have focused in on that may have kept you in school?
Being more comfortable with the students, I guess, because here we can be ourselves and still learn the process at the same time.
And they appreciate the results of their work.
I know hard work comes with great success, so I'm doing a lot of hard work and I'm getting a lot of things rewarded towards me. You know, I came from being getting paid minimum wage to now being a crew leader amongst the group, so you know, I'm getting a lot out of it.
The Milwaukee Fresh Start program has built 9 houses since its inception.
First couple of years, we built 1 house every 2 years. So in total, we've got 9.
Who are these houses being built for?
We build the houses for low to moderate income families, so they're affordable houses. On this particular site, we're building 3 fully accessible units to try to respond to the city's Americans with Disabilities needs.
I asked these young men how they see themselves living in 10 years, and their answers were the American dream.
Running one of these sites, telling somebody else what to do.
Family, home, ownership of a home, vehicles, the whole 9, basically. You know, just laid back, enjoy my life. You know, weekends go party, whatever I'm gonna do. Weekends go to work Monday through Friday. You know, live that life. That's what I want.
The Fresh Start project has given these young men a second chance and a chance to make a real contribution to their community.
A lot of young people coming down, and they see what we're doing, and they asking us how can we get hired, and you know, that's motivation towards them also. So we're doing a lot of good things that we're not even really paying attention to. I want your work to be grade A, quality. You learn this for a reason. You know, you learn it because you want to better yourself. You better yourself by, you know, learn from your mistakes. We make a lot of mistakes, and you know, you got to straighten them out, fix them up, and you know, the houses be sturdy. Gotta have them nice and tight. Can't have them loose.
We can for our neighborhood. We try to make it look good. We taking something that's empty and putting something to good use. We building a home where a low-income family be able to buy a home for them, be able to live and own, not have to rent, be able to have their own property, be able to come somewhere where they be like, this is my house. We try to bring the neighborhood from looking like it do to making it look nice.
Building that bridge for the next people to come across.
Last week, we discussed the Wisconsin Sheriff's Program and how the state was going after daycare abusers. A number of daycare providers feel that crackdown is hurting many innocent providers. We are joined by Beatrice Johnson, president of the United Alliance of Daycare Providers, and Leon Todd, organizer and advocate for daycare providers. Welcome to the show.
Thank you.
Thank you.
What is your concern with the effort to stop abuse within the Wisconsin Sheriff's Program?
My concern is it's being laid on the daycare providers, and it's not originating from problems that they have, but it's originating from an economy that's in a depression. It's originating from a state budget that's in red ink, and it's originating from a failed W-2 program that wants to place now the burden of sharing the blame for red ink at the state level.
Mr. Todd, give me some specific examples.
Okay. In the beginning, W-2, when the economy was booming, was hailed as a great success. When the economy began to fail, the state had no jobs for parents that W-2 put to work. So now that they have no jobs, why should the state be taking care of children when there are no jobs for the parents?
So your argument is primarily an economic argument in these hard times?
Absolutely.
Okay. Do you feel that daycare providers are getting an unfair rap, and if so, why? How, Beatrice?
Well, I really do feel like we are being treated unfairly, and this is because, you know, they're closing down without due notification. They're like drive-by close downs. You know, it's not an audit that is being done the correct way, and it's like we're just being put out there as these fraudulent providers when we all know the key word in fraud is intentional, not mistakes in paperwork or, you know, something that you may have done way back then before you got licensed or any of those factors. We're just being closed down on, like Mr. Todd said here, economy crisis.
So you are a daycare provider?
Yes, I am.
Do you think that you are being denied due process?
Well, yes, we were all denied due process when we were just closed down without having any notification of non-compliances that we would have to, come into compliance with. We were informed of these compliances after the fact that we were closed down.
So let's be a little clearer here for clarification. Your daycare was closed, correct?
Yes.
And you weren't given any reasons why?
No reasons why. I woke up, my name was in the paper, and then I found out I was closed. Or my payments were suspended, rather.
Mr. Todd, would you like to add anything to that, sir?
Well, certainly. Here we have a daycare provider who has obligations, mortgage obligations, rent obligations, payments for vans, and the state is now suddenly taking away the livelihood the bank doesn't want to hear, the landlord doesn't want to hear that the state has taken it away. It's her credit that's on the line. It's her reputation that's on the line. The state's actions are malicious. They are unreasonable. And in many instances, they are unfounded.
You said something earlier about it related to economics in terms of why this is occurring. Could you elaborate on that more, sir, in terms of the tax base, things of that sort?
Sure. In the beginning...
And by the way, Mr. Todd, we have a limited amount of time, sir.
In the beginning, the W-2 was hailed as a success. The economy was booming. Now, when the economy is in a depression status, there aren't jobs out there. Parents can't find jobs. Their children are in daycare. The state is having to fund the daycare without the added jobs that the parents should be getting. So who's to blame for this? Then they do an audit of the state, and when they do an audit, they find that there is millions of dollars missing.
Let me say this to you, because here's what I think I hear you saying. That due to the lack of tax dollars,
yes,
this Wisconsin Shares program is a way to get revenue. Is that what you're saying?
Oh yeah, they're grabbing for $4 million that's been budgeted and allocated, and they don't want to pay it to the daycare. So they're finding all kinds of excuses to go after and shut down the daycare and deliberately destroy black businesses.
That leads me to my final question. Do you feel that the publicity about the fraud and abuse hurts the Wisconsin Shares program? Either one of you.
Yes, we're being tried in the press.
If so, how? How is it hurting the program?
The press is presenting charges that are based on unfounded allegations in many instances, and the public is, as the jury, deciding that these daycare providers are guilty. The tone of the headlines, the tone of the articles is unfortunate and malicious.
Thank you all for joining us on Black Nouveau.
Thank you.
Through the years, the contributions of women in the armed forces have gone largely unrecognized. The psychological impact of military service tends to be much greater on women than men, and many don't realize that help is available through the Veterans Administration. Our intern, L.C. Satterfield, himself a veteran, talked with 3 women who are getting the help they need.
During the Korean War, a large number of African American women joined the military. They faced an uphill struggle from the onset, but persevered. In Milwaukee, the Zablocki VA Medical Center is helping them with issues ranging from mental health to alcoholism and substance abuse through its music therapy program. LaDonna Lavender found it to be a therapeutic resource.
Well, I joined up with the VA band here in February. My inspiration was a gentleman named Mr. Samuel White, also known as Pepper, who passed away in April. I always knew I could sing. The thing about it is because of other things I was involved in that wasn't conducive to what I'm doing now. There's a lot of negative things, drugs and alcohol, putting stuff on top of my voice. So since I'm not doing that, that my voice came back out again. So yeah, I sang at Summerfest here back July 5th.
Zablocki also offers an inpatient domiciliary treatment program for those with more serious issues.
I must say that out here at the VA, the doctors and nurses were very diligent with me in trying to talk me in to a rehab program that they have here, which is known as DOM 123. Started binging. My friend just had enough of me binging and brought me to the Veterans Veterans Hospital emergency entrance. Actually, he pulled up an ambulance is supposed to park. And he said, somebody needs to help this woman, because I was in an extremely poor way. Like I said, there was water and alcohol, and this was my diet, along with Excedrin sleeping pills. This was it. So I finally was seen, and the nurse said, well, I hope you're happy. You've blown out your pancreas. You're now diabetic.
Kentipur Hidarian, like LaDonna, has found her niche in music therapy.
But then I started singing with the group that's out here called the VA Jam Band. I started singing with them. That's how I got it started in the music, and I enjoyed singing. I just enjoy acting. It brought me out of me. It showed me a better way to do things, a happier way, really, just to get involved with that.
Tiffany Kaler draws from her military experiences to deal with life's challenges today.
As a woman veteran, I faced difficulties, I think physical challenges more so initially. Before I joined the military, I grew up in the Milwaukee area. I grew up in foster care, and I aged out of the foster care system. At the age of 18, I decided to go to college. I needed structure, I wanted to serve, and at the age of 19, I decided to join the U.S. Army. I have a new sense of self. I can step into these areas with confidence because, you know, when you get to a new place and you know, by the end of your training, you're running 2 miles, you know, it's steps. You take steps. And I've learned a lot. I serve in a lot of leadership positions within the greater Milwaukee area. I'm the chair of the Salvation Army Adult Rehabilitation Center.
All 3 of these women serve their country proudly, and as veterans, America salutes them.
And that wraps up this edition of Black Nouveau.
Remember, in the coming week, do something to expand your world. Good night.
Good night.